So my name is Kim Illingworth. I am a professor of pharmacy practice and then the Assistant Dean of Learning and Assessment at the College of Pharmacy at Purdue University. So the shortage, of course, from the patient side, there's delays in getting their prescription, and in many cases, these delays can impact their health in the long run. You know, if you have an antibiotic and for an infection and the person's not getting that antibiotic for 24, 48, 72 hours after the infection has already been diagnosed, it can have consequences, right? But also for the chronic disease medications people take for their chronic diseases, if they miss doses because they're not getting their prescriptions in a timely way, that can have significant consequences too. So for example, somebody who is on a high blood pressure medication, perhaps they aren't taking their medication, their blood pressure increases, that can lead to a risk of a heart attack and a stroke. And so those consequences are immense, beyond just the idea of the convenience of being able to get the prescription. For pharmacists, it's very stressful because you have people really pulling at them. Patients want their medications. Providers are wondering why patients aren't getting their medications in a timely way. And so they are trying to manage their workplace with managing their technicians and all the phones and the people and the immunizations and the COVID testing. And so they're just being asked to do more with less resources. And it creates a really difficult place in the pharmacy environment if they do not have the help that they need. So that's leading to pharmacists closing early, really questions of safety when you don't have the help. Is the person getting the right medication or not? Yeah, so I think there is the recognition that there is a shortage. Just a few short years ago, we were talking about an oversupply, and things have turned, especially after COVID, because people are making different choices in their career, and there are more choices for pharmacists to make and going to different career paths. So one thing is really focusing in on employee well-being. A lot of the national associations right now, they're looking at well-being and trying to provide resources and also work with companies to help in that area. Secondarily, they're also looking at pharmacy benefit managers and how they play a role in reimbursement to pharmacies, because often those reimbursements lead to who is staffed and who is not staffed. So there's state legislation that's going on across the country. There's certain states that are looking into that and looking also at what would create a safe environment, how many technicians to a pharmacist are allowed to work, as well as how many pharmacists are necessary. So I think there's a lot of stuff going on nationwide as well as locally.